Hi, today we're talking about cardiovascular risk and sedentary behavior. As we all know, most Americans and most people in the world spent a significant portion of the time just sitting and not doing active work. The human body is designed to actually be walking most of the time. This sedentary behavior is now called the second smoking. The commonly recommended 150 minutes per week physical activity guideline by WHO and many societies has a blind spot. It overlooks the 9 to 11 hours per day sitting that most people indulge in, and this is a massive metabolic blind spot. In studying patients from the UK Biobank, they found that there's an inflection point at 10 and a half hours roughly, wherein mortality goes up. So if we spend more than 10 and a half hours indulging in sedentary behavior, such as sitting, your risk of cardiovascular mortality goes up. Let's say you sit most of the time, but do more than 150 minutes of exercise per uh, day per week. This does not outrun the sedentary behavior. Therefore, meeting current exercise guidelines reduces AFib, macular infarction risks, but the elevated risk for heart failure and cardiovascular mortality remains. People then came up with a standing desk idea, thinking that the standing desk will surely overcome the sitting problem. But over long term, standing more compared to sitting did not provide any significant improvement in cardiovascular health. As a matter of fact, standing for long times in a static position increased the risk of varicose veins, DVT, impaired venous return, and elevated peripheral vascular resistance. What about exercise snacks? Reducing sedentary time every 30 minutes was found to be highly efficacious for reducing postprandial glucose levels compared to longer, less frequent bouts. Now, a very interesting study looked particularly at the soleus muscle. Soleus muscle makes up only 1% of the total body weight. It is unique. 88% of the muscle is made of slow twitch type 1 oxidative fibers. As we know, in obesity, these fibers are replaced and resulting in poorly efficient muscle overall. But focusing on the soleus itself, it is a slow twitch muscle. It's a postural muscle designed for endurance. So the researchers felt that using this muscle for a long time would be possible and would not put an undue burden on sedentary people who are not used to exercising. So they looked into the biochemistry of this muscle further, and they found that it has high vascularity, it has hexokinase 2, it has GLUT4 transporters, it is low in glycolytic enzymes and glycogen phosphorylase. Therefore, it is fundamentally designed to oxidize blood-borne fuels such as plasma glucose and VLDL triglycerides rather than relying on stored intramuscular glycogen. At rest, the skeletal muscle accounts for only 15% of the whole body postprandial glucose oxidation. Therefore, when people talk about if you have more muscle, you burn, it's not exactly accurate if you're spending most of your time sitting around. Mitochondrial phosphorylation is capped during inactivity. You cannot clear circulating glucose efficiently when the muscles are at rest. Therefore, they came up with an idea of a soleus push up. In a soleus push up, the toes should be behind the 90-degree angle, and if the toes are behind the knee, then when you raise your heel up, you use predominantly the soleus muscle. Now, bending the knee press makes the gastrocnemius flaccid, and therefore the soleus performs 80% of the recruited muscle work. In their research, researchers had patients do this, or actually, sedentary individuals do this for almost 4.5 hours. And they were able to do this without any issues. When they studied the metabolic benefits, Systemic energy expenditure went up by 1.3 to 2 METs with the Soleus push-up, but local muscle VO2 in the Soleus muscle went up to 237 ml per minute per kilogram. Now, the Soleus push-up therefore drives local oxidative metabolism to near maximal levels without causing systemic neurohormonal stress, fatigue, or sweating. Heart rate and blood pressure remain completely stable. Then, what they found was very interesting. There was a net Soleus glycogen reduction, only 22 millimoles over the 4.5 hours studied. Soleus glycogen accounted for only 4% of the total energy expended. Because the Soleus muscle does not use the local glycogen, it feeds directly from the bloodstream, allowing continuous hours of contractile activity without local fatigue. What they found was before the Soleus push-up intervention and after Soleus push-up intervention, there was a significant drop in the blood glucose and the body became more or less insulin resistant. 75% oral glucose, 75 gram oral glucose tolerance test results showed that the Soleus push-up contractions reduced postprandial glucose excursions by 50% and reduced hyperinsulinemia by 60%. In addition, there was rapid clearance of the VLDL triglycerides. Acute local activity directly dictated plasma lipoprotein-derived triglyceride uptake via microcirculation mechanisms and the continuous oxidative burn pulls circulating lipids into the bloodstream. Therefore, if you do Soleus push-up, then you utilize slow muscles and using this highly specialized muscle, you hijack the systemic metabolism without triggering systemic stress responses such as catecholamines. And this 1% body mass can double the total body carbohydrate utilization. The large body whole muscle is inactive, whereas the Soleus muscle less than 1% body mass is active and burns glucose. Therefore, first of all, you should try and break the 30-minute rule by doing activity. Preferably in this activity, use muscles that burn the glucose, and an easy method would be to do the Soleus push-up. The static stand idea does not really help. The key takeaway, therefore, is to limit the 10.5 hours of sitting that people commonly do. Static standing does not reduce cardiovascular risk. Mechanisms such as Soleus push-up, walking every 30 minutes, doing squats, all of these would help, but the most bang for the buck is likely with the Soleus push-up, which is easy to do. Thank you for listening. More to follow.